We live in a world where certain dangers have become so ordinary, we barely notice them. Think about it. Lighting a cigarette, raising a glass of wine. These acts are woven into our daily lives and celebrations. Their normalization creates an illusion of safety, making us believe that if everyone does it, it must be harmless. But what if these habits are silent architects of disease and suffering? Society frames cigarettes as stress relievers and alcohol as a way to unwind, but science tells a different story. These substances are chemicals that disrupt and damage our bodies. The evidence is clear. The risks are real, even if we rarely stop to consider them. Today, let's step back from the noise and look at the biological reality. We'll explore, in simple terms, what really happens inside us when we use these substances. Understanding the mechanisms of harm is the first step to making informed choices about your health. Let's begin this deep dive and arm ourselves with the truth. A cigarette looks simple, but once lit, it becomes a chemical factory. Over 7,000 chemicals, hundreds toxic, at least 70 causing cancer. You're not just inhaling smoke, you're inhaling a cocktail of poisons, engineered to be addictive. Tar coats your lungs, carbon monoxide starves your organs of oxygen, and chemicals like formaldehyde and arsenic add to the damage. Cigarettes are designed to deliver nicotine to your brain in seconds, creating an immediate hit and a powerful addiction. Additives make the smoke smoother, tricking you into inhaling more deeply. Smoking isn't just a habit, it's a repeated, direct assault on your body. Each puff damages your cells, and over time, the harm accumulates. The body can only take so much before the foundations of your health begin to crack. The damage from smoking starts with the first puff. Heart rate and blood pressure spike, oxygen drops, and your lungs become inflamed. Over time, tar destroys the cilia in your airways, leading to chronic bronchitis, emphysema, and a skyrocketing risk of lung cancer. Smoking damages arteries, raising the risk of heart attack and stroke, and accelerates aging throughout your body. Your skin loses its glow, wrinkles form early, and your teeth and fingers stain yellow. For men, blood vessel damage can cause erectile dysfunction. For women, it can harm fertility and pregnancy. Every system is at risk, from your appearance to your ability to have a family. The effects are not just cosmetic or temporary, they're life-altering and often irreversible. Smoking ages your body at every level. The risks are real and the consequences are severe. Every cigarette is a step closer to chronic disease. Alcohol is the world's most accepted drug, woven into celebrations and daily life. But biologically, it's a psychoactive depressant and a toxin. Alcohol is absorbed directly into your bloodstream, reaching every organ, including your brain, within minutes. Your liver works to detoxify it, but the main byproduct, acetaldehyde, is highly toxic and carcinogenic. Drinking faster than your liver can process leads to a buildup of toxins, damaging cells throughout your body. Binge drinking floods your system, causing widespread inflammation and stress. Responsible drinking isn't just about avoiding embarrassment, it's about protecting your organs from toxic overload. Even a single night of heavy drinking can set off a chain reaction of harm. Heavy drinking first damages the liver, fatty liver, then hepatitis, and finally cirrhosis, where scar tissue replaces healthy cells. A failing liver can't filter toxins or process nutrients, leading to life-threatening complications. Alcohol also shrinks and damages the brain, causing memory loss and cognitive decline. It disrupts neurotransmitters, worsening depression and anxiety. The heart suffers too. High blood pressure, irregular heartbeat, and weakened muscle are all risks. Alcohol disrupts hormones, lowering testosterone in men and increasing breast cancer risk in women. The World Health Organization classifies alcohol as a Group 1 carcinogen, directly linked to at least 7 types of cancer. Even low levels of drinking increase cancer risk, especially for breast cancer. The more you drink, the higher your risk. There is no truly safe amount of alcohol when it comes to cancer. The damage is cumulative and often invisible until it's too late. Illicit drugs, stimulants, opioids, hallucinogens all hijack the brain's reward system. They flood the brain with dopamine, creating intense pleasure far beyond natural rewards. Cocaine blocks dopamine reuptake. Opioids create euphoria and block pain. The brain adapts by reducing dopamine receptors, making normal life feel dull and driving the need for more drugs. Tolerance builds, doses increase, and addiction takes hold. The consequences are severe: paranoia, psychosis, depression, and physical health crises. Stimulants strain the heart. Opioids can stop breathing. Injecting drugs risks deadly infections. The pursuit of a high leads to the destruction of mind, body, and spirit. The cycle is relentless and devastating. The initial pleasure is quickly replaced by a life of dependence and decline. Addiction is a chronic brain disease, not a moral failing. Drugs physically rewire circuits for decision-making, judgment, and memory. The brain's control center weakens, while the reward system becomes hypersensitive to triggers. Cravings become overwhelming, making it nearly impossible to resist. Stopping isn't just about willpower, it's a battle against your own rewired brain. Recovery requires more than abstinence. Therapy, medical support, and a strong network are essential. Understanding addiction as a disease removes stigma and opens the door to real help. The brain can heal, but it takes time, effort, and support. Compassion and science are key to recovery. Prevention is the most effective strategy, especially for young people whose brains are most vulnerable. Build a life rich in natural rewards. Exercise, strong relationships, and meaningful hobbies. Avoid triggers and develop healthy coping skills for stress and boredom. If you're struggling, seeking help is a sign of strength, not weakness. Talk to someone you trust and seek professional support, counseling, support groups, or medical treatment. Mindfulness and spiritual practices can also provide resilience and peace. Recovery is possible, and every positive choice builds a healthier future. Protect your brain and body. They're your most valuable assets. Cigarettes, alcohol, and drugs aren't harmless habits. They're powerful agents of disease and dependence. The relief they offer is fleeting. The damage is lasting. The real choice is about the life you want to live. True strength is protecting your health. Your body and brain are irreplaceable. Every choice matters, shaping your future day by day. Value your health as a precious gift, not something to take for granted. Make the conscious decision to stay safe, healthy, and in control. Turning away from these substances isn't deprivation, it's freedom. You're giving yourself everything: a longer, stronger, and more fulfilling life.